Okay, so let's go into chromosomal disorders. We've been talking about single gene defects, right? So that's where we can use a Punnett square. That's where we can calculate how is this single gene defect inherited, whether dominant or recessive, homozygous or heterozygous. Sorry to have to repeat that. But now we're going to talk about chromosomal disorders, right? So, these disorders increase over the age of 35 in women, right? So why? Well, women are born with all of their eggs at birth. Like they have approximately 300 to 350 eggs at birth. So over time, those eggs are being affected by aging. Okay, so even though uh, you cycle every month as a female and normally produce an egg, the eggs have been there since birth, right? So they've been exposed to all of that time. So over the age of 35, um, you can run into chromosomal disorders within the eggs. Okay, so what can these disorders be due to? So damaged chromosomal structures, so such as inherited defects or acquired DNA mutations um, in certain genes, or there's just a totally abnormal number of chromosomes because during meiosis they didn't separate properly. So you might have um, one gamete that has one completely extra chromosome, or you might have a gamete that has one completely missing chromosome. Okay, so Down syndrome, for example, is a condition where you have an extra chromosome at number 21. So trisomy 21. Turner syndrome is where you're missing an X chromosome. So we call it XO. Okay? All right, we'll keep on going here. Okay, so let's look at the process of non-disjunction. Okay, so it's where chromosomes fail to separate properly during meiosis. And when do we think um, of of non-disjunction? Well, it's the production of gametes, right? The sperm and the egg, because you want half the information, the genetic information, in each one of them, so that when they combine, they complete themselves and they get full genetic makeup. Okay, so on the left is what should happen, and on the right is what can happen with non-disjunction. And if you look what's happened, one gamete is left with a completely missing allele, and the other gamete has two alleles within it. So you can imagine when the one that's missing an allele completely combines with a gamete, another gamete, then you don't have 46 chromosomes. You have 45 chromosomes. And when the one with two alleles mixes, it results in an extra chromosome, 47 chromosomes instead of the normal, which is 46 or 23 pairs, right? Remember, we have 23 pairs of chromosomes, 22 autosomal and one sex linked. Okay, so when we're talking about chromosomal disorders, we can talk about abnormal numbers of uh, of chromosomes. And if you remember that slide on a karyotype, which is basically a staining of someone's genetic makeup, looking at all their chromosomes, well, on the karyotype, they would be able to see that there is a chromosome missing or there's an extra chromosome. Okay? So, and this process happens because of non-disjunction during meiosis. Okay? So the germ cell is left with either 22 chromosomes that's going to pair with another germ cell, or it has 24 chromosomes, one extra. So now the fertilized cell has either 45 chromosomes because it didn't get one, or it has 47 chromosomes because it has an extra one. Okay? Monosomy will call the condition where you're missing a chromosome. Okay? So this will be 45 chromosomes instead of 46 chromosomes. And these often lead to a miscarriage, okay? Because many of them are not compatible with life, they will lead to a miscarriage. The body will, through its process of looking at the fetus and deciding if it has all the genetic material, some of them will result in miscarriages to prevent the fetal to continue developing. Okay. There is one called Turner syndrome, where you are missing one X chromosome. And we'll get to an image of Turner syndrome. So it's going to be a female that's missing one X chromosome. Okay, it is compatible with life for sure. Okay, but there's many others that never get to birth because of a completely lacking chromosome. Okay, so here's Turner syndrome, and there's a karyotype on the right. So let's look at the bottom right. Okay, it's missing an X chromosome completely, and that's why we refer to it as XO instead of XX. Okay, so we're going to call it a monosomy because there's just one X chromosome. And typically, with this condition of Turner syndrome, the phenotype is female, and they often have a short stature. They have a bit of a webbing of their neck. I think we'll have a slide with a picture coming up. They're typically infertile because of ovarian failure. They can develop abnormal cardiac valves and a very narrowed area of the aorta called coarctation. And on top of that, because of that narrowed aorta, it can actually lead to chronic hypertension. That's a smaller detail in terms of coarctation and hypertension. The image will help explain that a bit more. Typically, this condition doesn't lead to reduced intelligence. Sometimes they can have learning difficulties, but usually their intelligence is completely intact. Okay, so here are some of the symptoms and signs of Turner syndrome. Remember, missing one X chromosome. So they still have female characteristics, okay? They have a bit of a webbing of the neck or a fold of the neck. So instead of the neck coming down straight, it often comes down with a bit of a web appearance. I mentioned this constriction of the aorta that can lead to hypertension. They often have a chest breastbone that comes out. Okay, so it's called pectus excavatum. I wouldn't worry too much about that. They often have poor breast development. They have they're infertile because they have poorly developed ovaries, so they don't have any regular periods at all. I think that would be most of them. Remember, they also have a short stature. Okay, there's some other ones that I'm not going to go into here, but I think we hit on the major ones. Okay, so let's look at a chromosomal disorder from an extra chromosome. So Down syndrome, trisomy 21. So during meiosis, one of the gametes um, uh, didn't divide properly, so it resulted in an extra autosomal chromosome at site 21. So now the fetus has 47 chromosomes instead of 46. So what's the chance? The chances of trisomy 21 or Down syndrome increases with the age of the female, right? So typically we use 35 as a cutoff, and as you go um, beyond 35, your chance of having a child with Down syndrome increases, okay? Because the eggs are that much older, right? They've been exposed to more aging. So they have a chance of having chromosomal abnormalities, okay? There's other trisomies on other autosomal chromosomes. So there's trisomy 13, 18, 22. Many of these will result in a miscarriage. Okay, so the body decides that this isn't compatible with life and a miscarriage will occur. So miscarriages early on in pregnancy um, are very upsetting events, but it's part of the body's way of deciding whether the fetus is viable. Okay. So now some of these can survive to infancy, but many of them aren't compatible with life. Trisomy 21 Down syndrome, definitely compatible with life. They don't have a full lifespan, but they certainly live many decades. Okay, and we'll go into we'll discuss some typical characteristics of someone with Down syndrome on an upcoming slide. Okay, so Down syndrome, let's look at the 21st autosomal chromosome. There's 3 chromosomes there, okay? And that occurred because of non-disjunction during meiosis. So at the age of 20, well, you have a 1 in 2,000 chance of having a fetus or a newborn with Down syndrome. Pretty low. At the age of 48, it's a 1 in 20 chance. Now, if I was to ask you, um, who who has the most patients with Down syndrome, the younger population or the older population beyond 45, it's still the younger population because they're the ones that are having by far the most children. So even though the chance per pregnancy is very low, they're having many, many more children. So overall, Down syndrome will still, in terms of sheer numbers, be from younger women. Okay, I don't know. I hope that makes sense. Um, so, and the fact that women over the age of 45 aren't having many children, even though their risk per child is much, much higher, there's less children being born to them. Okay, I hope that makes sense. Anyway, so this syndrome results in growth failure. It results in mental retardation and early dementia. You'll notice that children and adults with this condition are often really happy-go-lucky kids and adults. The vast majority of the ones I've met are very content and happy children. Now, they develop a number of congenital defects, right? So they have heart defects. They have holes in different parts of their heart, connecting chambers that shouldn't have communication. They're very prone to leukemia and lymphoma as they get into their 30s and 40s, okay, because of this genetic abnormality, this extra chromosome. They typically have a large tongue and they have abnormal eye folds, and we'll come to a slide on that. Their ears are low set, okay? They have what's called a simian crease, so a crease that grows right across their palm. So if you look at your palm right now, you likely don't have a crease that goes completely from one side of your palm to the other, okay? And they often have a wide gap between their first between their first toe, and they have a short and sometimes a webbed shaped neck. Okay, so we'll come to a slide on that. Okay, so let's look at some characteristics of a child with Down syndrome from this extra chromosome at the 21st site. Okay, so when they're born, children with Down syndrome often have really low muscle tone. We call them hypotonic, right? So, or hypotonia. They have excessive, they have some webbing of their neck, okay? They typically have a flattened nose. They have low set ears, okay? And the ears are typically smaller. They have a small mouth. They often have short hands and short fingers. And remember, I mentioned that single simian crease that goes right across the palm. That's very common in Down syndrome. And there's a few others on here that you can look at, such as the wide separation from the big toe to the other toes. This doesn't mention, of course, the mental retardation, the congenital heart defects they have. So these are just some findings that are very typical to a child with Down syndrome. Okay, so here's some more characteristics of someone with Down syndrome, trisomy 21. So the growth failure we spoke a bit about, the mental retardation. They have, so the epicanthal folds are the tissue around your eye. Their folds are different, so it gives them a characteristic facial feature. We mentioned that they have a small nose, large tongue, low set, small ears. They have congenital heart diseases, okay? And often they need cardiac surgery because they have holes between, say, the ventricles that haven't closed yet, okay? They can have abnormal intestinal formation. So they can be prone to obstructions, bowel obstructions, because the intestine hasn't quite developed normally in the abdominal cavity. The short hands with the simian crease, the wide gap between the first and second toes, and lastly, the development of lymphoma or leukemias in their 30s or 40s is common in patients with Down syndrome. Okay, so let's look at another non-disjunction chromosomal disorder. So Klinefelter's disease is someone who's acquired an extra X chromosome. Okay, so it's a male, they have a Y chromosome, but they have an extra X chromosome. Okay, so the symptoms and signs can be very subtle. Okay, in fact, some of these patients don't even realize they have a chromosomal disorder, but others, it will result in infertility. It's going to result in small testicles, delayed puberty, typically above average height, potentially some feminization, so enlarged breast tissue. Their voice may not change, and they may have less male characteristics, such as less muscle mass, and less facial and body hair. Okay, and we'll look at an image of someone with Klinefelter's syndrome. Okay, so here's Klinefelter syndrome, and often some of these characteristics are noticed at puberty, right? So let's start on the right. So absence of baldness or frontal baldness absence. Okay, well, they have an extra X chromosome, so they may not have typical male pattern baldness. Decreased beard growth, so decreased facial hair. Again, because they have some feminization from the extra X chromosome. Some breast development, small testicles, female pattern pubic hair, potential for some gynecomastia, some breast enlargement, okay? Lack of chest hair. Typically, their IQ is either normal or just slightly reduced. Okay, so there's not a lot of mental delay associated with this condition. And they have a tall stature, so they're on the tall side. And just remember, because of that X chromosome, they have feminized characteristics. Now, lastly, because of the small testicles and the feminization, often patients with Klinefelter's syndrome are infertile, right? They have small, poorly functioning testicles that don't produce normal amounts of sperm.